All right, guys, welcome back to Underground Science. In this video, we'll be talking about paradoxical splitting of the S2 heart sound. Now, make sure to go and watch the wide splitting of the S2 heart sound video that we made, because that is where we talked about physiological splitting, and then we built upon that and talked about wide splitting and its causes, right? So, just as a quick review, if we take normal a normal circumstance, right? So physiological splitting, and we say that this top is going to be inspiration and the bottom is going to be expiration, and we draw S1, S1, right? The S1 heart sound, and then we said S2 is split into an A2 component or an aortic valve component and a P2 component or a pulmonary valve component, right? So if we draw that, we're going to see that the A2 component comes first. Why? Because we mentioned in our wide splitting video that the left ventricle is under a much higher pressure. It contracts at a much higher pressure than the right ventricle does. And so if the left ventricle contracts at a much higher pressure, it can eject that blood out, right? Fast, and it can eject that blood out faster than the right ventricle, and therefore the aortic valve can close quicker. That's why it comes before the P2 component of S2, right? So the P2 component comes after. Why? Because the right ventricle contracts at a much lower pressure than the left ventricle. So it takes longer for the right ventricle to pump all its blood out into the pulmonary artery. Therefore, it takes longer for the pulmonary valve to close. All right, so that's what happens normally. Notice though, normally on inspiration, you have splitting of the S2 heart sound, okay? Because when you take a deep breath in, you decrease intrathoracic pressure. And when you decrease your intrathoracic pressure, more blood rushes into the right side of your heart, right? So you increase preload, right, when you take a deep breath in. And if you increase the amount of blood going to the right side of your heart, that means your right ventricle is receiving more blood than usual. If your right ventricle receives more blood than usual, then that means it's going to take a longer amount of time for your right ventricle to pump that extra volume of blood into the pulmonary artery. And if it takes a longer amount of time for the right ventricle to pump that extra amount of blood through the pulmonary valve and into the pulmonary artery, then that means it's going to take a longer amount of time for the pulmonary valve to close, right? So that's why on inspiration, your P2 comes after your A2, okay? And then, of course, when you do expiration, you increase that intrathoracic pressure again. And that means more blood goes to the left side of your heart, less blood goes to the right side of your heart. And then you have A2 and P2 together. Okay. So it's not split. This is physiological, right? In normal conditions. Now, in the wide splitting video, we explained that on inspiration, you have splitting of your A2 and P2. And on expiration, you also have splitting, but it's a little less, right? And we went over the reasons there, right? We said some causes can be right bundle branch block, and then we said pulmonary hypertension or pulmonary stenosis and things like that, right? So make sure you go and watch that wide splitting video so that can make more sense. But this video, we're going to talk about paradoxical splitting, and it's basically the opposite of physiological splitting, okay? Because this right here that we drew, okay, this right here, this is physiological splitting. Paradoxical splitting is basically this. Take the A2 and put it in front of the P2. That's it, right? That's paradoxical splitting. And let's see why this happens. So in paradoxical splitting, right? First, let's talk about the causes, okay? So what are some causes of paradoxical splitting of the S2 heart sound? One cause can be a left bundle branch block. Notice how when we talked about wide splitting of the S2, one cause was right bundle branch block. Okay, so in paradoxical splitting of the S2, one cause is left bundle branch block. Now let's see how this works. So let's draw a quick sketch of the heart, which I already drew. Okay, and let's see how this works. So in paradoxical splitting, we said what, right? So let's draw the graph that we were drawing before. So this is the time, x-axis is the time. We have our S1, actually, let's do that in different color. We have S1 here, and then the focus is the S2. So we're going to say that the A2 component, right, comes after the P2 component in paradoxical splitting, right? So the P2 component actually comes before, and this is going to be on expiration, okay? So this is going to be on expiration, and all this will make sense in just a bit. Let me just write this out. So this is on expiration, and then let's draw our inspiration graph. S1 is right here. And then what happens on inspiration actually is that you actually don't get splitting of the S2, okay, because they come back together. We'll explain that in just a bit. So you have P2 and A2 together. All right, so no splitting. And notice how this is different from wide splitting S2 because in wide splitting of the S2 heart sound, on expiration you have splitting and on inspiration you have splitting, but it's even greater, right? So this is on inspiration. All right, perfect. So now let's explain why this happens. So let's say, right, we have a left bundle branch block, okay? So if we quickly draw out our electrical system of the heart, right, we know that you start from the SA node, then you go to the AV node, right? And then from the AV node, you go to your bundle of His, and then your right bundle branch, left bundle branch, and then eventually to your Purkinje system, right? If your left bundle branch is knocked out for whatever reason, whether that be infarction, right, or whether that be some infiltrative disease like sarcoidosis, or whether that be cardiomyopathy, right, stretching of the heart wall can damage this electrical system, the left bundle branch. Whatever the case may be, if your left bundle branch is damaged, right, then the conduction along it will be delayed, right? And if the conduction along it is delayed, then it's going to take a longer amount of time for your left ventricle, the myocardium of your left ventricle, to contract, right? If it takes a longer amount of time for your left ventricle to contract, that means your aortic valve will close at a later time, right? Because if it's taking a long time for your left ventricle to push that blood out into the aorta, then your aortic valve will stay open for longer and it's going to take a longer amount of time for your aortic valve to snap shut, right? So that's why when you look at this graph, you see the A2 component comes after the P2 component. And so on expiration, what happens is you push more blood to the left side of your heart. So now if you have a bundle branch block already, right? If you have a bundle branch block already, so conduction's already delayed. Your left ventricle myocardium's already taking a long time to contract, right? On top of that, if you breathe out, you push more blood into the left side of your heart. So now with your myocardium's already delayed, and on top of that, you have much more blood in your left ventricle now. So if you pair those two together, you can imagine that it's going to take now even a longer amount of time for your left ventricle to contract and push all that blood out through the aortic valve and into the aorta, which then would mean that it's going to take a longer amount of time for your aortic valve to close, right? So that's why in expiration, you see the A2 component actually coming after the P2. And then when you ask the patient to breathe in, you're going to notice that the split goes away. Why? Because remember, when you breathe in, you do what? You decrease interthoracic pressure, which means more blood comes to the right side of your heart, and your right ventricle now has to deal with an increased volume, which means it's going to take a longer amount of time for your right ventricle to pump that blood into the pulmonary artery, which means it's going to take a longer amount of time for your pulmonary valve to close. Okay, so that's why when you do inspiration, notice how the P2 component shifted, right, towards the A2 component, right? So if the x-axis is time, the P2 component shifted that way, meaning it took a longer amount of time for the pulmonary valve to close when you take a deep breath in. Okay, again, because more blood goes to the right side of your heart, preload goes up. And if more blood comes to the right side of your right ventricle needs to pump an increased volume of blood now through the pulmonary artery, through the pulmonary valve into the pulmonary artery. And if your right ventricle has to pump more blood now through the pulmonary valve, then it's going to take a longer amount of time to do that, right? And if it takes a longer amount of time to do that, then that means the pulmonary valve will now stay open for longer and close at a later time. Okay, that's why on inspiration, your P2 and A2 components come together and you don't have splitting. But on expiration, you do. Okay, and that's paradoxical because it's the opposite of physiological splitting, right? That's why it's called paradoxical splitting of the S2. Okay, so we went through one cause, which was what? So let's write it over here. One cause was a left bundle branch block, and we saw why that can be a cause. And the other cause to know is aortic stenosis, right? Severe aortic stenosis. Now, why would this be a cause, right? So if we just drew another quick, simple rough diagram of the heart, right, like this, why would aortic stenosis be a cause for paradoxical splitting of the S2 heart sound, right? Because if your aortic valve, right, let's say this is the aortic valve and then it enters the aorta, right, like that. If your aortic valve is very fibrotic and does not want to open, right, is very stiff, then imagine how hard your left ventricle has to pump in order to push blood across that stiff valve into the aorta. So if your left ventricle has to pump really hard, right, has to work super hard to pump blood across that stiff aortic valve and get that blood into the aorta, wouldn't that mean that your left ventricle will take a longer amount of time to pump blood through the aortic valve, right? That would mean that your left ventricle now has to spend an extra amount of time to pump that blood that it has through the aortic valve because the aortic valve is very stiff and fibrotic and does not want to let blood through, right? So that means ejection time is prolonged now, okay? So now your left ventricle is having to work really hard and it's taking a long time for it to pump all its blood that it has through the stiff aortic valve and into the aorta. And if now your left ventricle is working harder, taking a longer amount of time to pump all that blood through the stiff aortic valve, that means that the aortic valve now will close at a later time. Again, indicating why the A2, right, comes after the P2. Okay. And so that's the other main cause. So those are the two main causes that we should keep in mind is a left bundle branch block and severe aortic stenosis. All right. So that's paradoxical splitting. Okay. I hope this video made sense. I hope it wasn't too confusing. Thank you guys for watching and see you guys in my future videos.